Good morning, everybody. It's wonderful to be here at Shanes Park in Western Sydney to make a very important announcement about this area becoming a national park of more than 500 hectares in the future. And I'm very pleased to have with us the Minister for the Environment, Matt Kea, and also the Minister for Western Sydney, Stuart, Ayres, who've worked tirelessly to make this a possibility alongside community advocates. But in relation to our health update, very pleasingly, New South Wales has passed the 85% figure on first doses. That is an outstanding result, and as we literally gallop towards that 70% double dose, it's very pleasing to see that number go up, and I'd love to see us hit that 90% figure in the near future. In terms of second doses, we're just off 60%, so we're at 59.25% today, and I'm hoping in the next 48 hours we'll definitely hit that 60% double dose figure, which again is a wonderful achievement for New South Wales. 12 to 15-year-olds, we have 37% who've received their first dose, and I want to thank parents for really going to that effort in encouraging their children or encouraging that age group to be vaccinated. And when we hit that 70% double dose, the knowledge that we'll be around at least 90% first dose plus coverage of that 12 to 15 age group gives us that extra level of comfort that we're able to proceed safely at that stage. To 8 p.m. yesterday, we had 961 cases of community transmission, and unfortunately 9 people lost their lives to 8 p.m. yesterday, and we extend our deepest and heartfelt condolences to the loved ones of those who died. And Dr. Jeremy McAnulty will give an update in his report. Pleasingly, we are seeing case numbers in southwestern and western Sydney continue to have a downward trend, but unfortunately in the Illawarra and Central Coast we're seeing more case numbers than we'd like to see, so we ask those communities in particular to remain vigilant. Now, there's not long to go before New South Wales starts approaching that 70% double dose figure, and I ask everybody to please hold the line. It's really important that we work hard now so that when we do start opening up at 70% double dose, we're able to do so safely and by bringing everybody together with us. And I do want to foreshadow that the New South Wales Government is very close to finalising our roadmap for 80% double dose, but also our roadmap as to when unvaccinated people will be able to participate in greater activity, and we'll be releasing that this week. And I want to thank all those in government and experts who've been providing input into that process, as well as stakeholders. But today, being at Shanes Park is a wonderful reminder that whilst we are dealing with the pandemic, dealing with the challenge of what comes our way, we're also making sure we get on with good government and good policy, and converting more than 500 hectares of this bushland into a national park is a huge boost for the community. There'll be animal species reintroduced here that haven't been here for a long time. There'll be opportunities for local residents and people from all across the state, all across New South Wales, to come here and enjoy the natural surrounds. And I want to thank all those involved in the process, especially obviously Minister Kea, Minister Ayres, but also the National Parks and Wildlife staff who've worked hard with community advocates to make this possible. I know many have been calling for this for a long time, and it's wonderful to see a national park of this size right in the heart of Western and northwestern Sydney. I understand the largest national park declaration in the last decade, a huge boost for our community and a huge boost for demonstrating how important our government values outdoor space, but also protecting our wonderful flora and fauna. I'll ask Dr. McAnulty now to give the health update. Minister Kea and Minister Ayres will then say a few words about the new national park, and then we'll take your questions. Thank you.
Thanks, Premier, and good morning, everyone. I'd like to give you an update of the COVID numbers from yesterday. There were 961 locally acquired cases of COVID reported in New South Wales, the 24 hours to 8 o'clock last night. And there were 3 overseas acquired cases in the same period. And there were 106,451 tests reported to 8 o'clock last night. In terms of vaccination, we're seeing terrific numbers with over 9.6 million vaccines delivered in New South Wales, with 85.2% of the over 16 population receiving a first dose of vaccine and 59.2% being fully vaccinated. These numbers are terrific, and really thanks to the community for coming forward for getting vaccinated. We'd really like to push the 16 to 39-year-old people to come forward for their doses as well. It's important that we all come together to raise levels across the community, and though younger people come forward, please, for vaccination to help protect yourself but also your loved ones and your communities. In terms of hospitalisations, there are currently 1,146 patients admitted with COVID into hospital. 222 people are in intensive care, 117 who require ventilation. The highest numbers of cases by suburb include the suburbs of concern are Auburn, Guildford, Punchbowl, Merrylands, Penrith, Bankstown, Bosley Park and Liverpool. So wherever you are in New South Wales, but particularly in those suburbs seeing the highest numbers, be aware of symptoms, come forward for testing, as you've continued to do, and we're really grateful for people coming forward for testing throughout this period. We've seen a number of sewage detections in regional areas without known cases yesterday. And I'd like to call out those areas and really encourage people in those towns to come forward for testing with even the mildest of symptoms. That's in Muswellbrook, in the upper Hunter Valley. Grafton, the Grafton North and South sewage systems have tested positive, and Wardell on the north coast. And Darrton has had a number of positive sewage tests, and that's in the far west corner of New South Wales. Please come forward for testing with even the mildest of symptoms in those areas. Sadly, we've reporting 9 people who've died with COVID yesterday. That includes 6 men and 3 women. 1 person was in their 40s, 2 in their 60s, 2 in their 70s and 4 in their 80s. 8 people were unvaccinated and 1 had received 1 dose of COVID vaccine. 3 people who died were from southwestern Sydney, 4 from western Sydney, 1 from Sydney's inner west and 1 was from Sydney's inner city. We extend our deepest sympathy to the family and loved ones of these people who have sadly died. Thank you very much.
Good morning, everyone. Today is a special day for the people of Western Sydney. Today we're announcing your very own Noah's Ark. This will be the first national park declared in Western Sydney in over a decade, and we're turning it into a special conservation area which will be home to some of our most threatened and endangered native animals. Koalas, quolls, bettongs and bandicoots will be filled in this area, and literally the bush will be alive with native animals that haven't been seen here for, in some cases, over a century. It will be accessible for all. We'll be building boardwalks and walking trails and making this a special place for not only Western Sydney but everyone across New South Wales who cares about our natural environment, cares about our native animals and wants to see them not only survive but thrive into the future. It's an incredible day. Again, we're creating Noah's Ark right here in Western Sydney and repopulating it with our most endangered and iconic native animals.
Thank you, Premier. Thanks, Matt. What an outstanding day for Western Sydney, the ability to bring a new national park to life. It's a national park in the city. It's a national park in Western Sydney. The one thing we know about Western Sydney is it's going to continue to grow. More people are going to have to live in this part of Sydney. And as we grow, we want to make sure that we don't lose our natural landscapes, that we manage our property, that we manage our land holdings to ensure that we as people can live side by side with our natural landscapes, our natural flora and our natural fauna. This investment in a new national park here in Western Sydney sticks to our commitment to get that balance right in Western Sydney. We want to make sure that this isn't just a home for new animals and returning animals and a place to protect an amazing natural Australian landscape, but it's also a place that people right across Western Sydney and indeed all of New South Wales can come and enjoy. It's a new home for Australian native wildlife. It's a place where we can rehabilitate to a better standard than what it's seen for many, many decades. Western Sydney's absolutely the winner today.
Are you considering making unvaccinated people wait until 90% of us are double dosed? And what's behind that thinking?
Look, firstly, can I thank the overwhelming majority of our citizens who've recognised the importance of vaccination. Dr Chan and I have been saying for a long time, as has Minister, that we're looking forward to Australia and New South Wales having some of the highest vaccination rates in the world. And the fact that we've so quickly already reached 85% first dose demonstrates the vast majority of our citizens appreciate how important this is. We will make sure that we reopen to everybody once it's safe to do so. We're going through the final touches of what our policy will be in that regard, and I'm looking forward to sharing that with the community this week. But I strongly urge everybody to come forward and vaccinate. If you don't have a medical reason as to why you shouldn't be vaccinated, please come forward and get vaccinated. We know that if we want to live with COVID safely, keep our loved ones protected, the best way to do that is to have great coverage of vaccination, and I urge everybody to do that.
Premier, one of the key elements, Premier, of the 70% roadmap was intra-state travel to the regions. Will people still be able to book a holiday to any regional area in New South Wales when we get to 70% double dose?
We're looking at when that should occur. We had foreshadowed it was likely to be at 70%. It may very well be at 80%. We know there'll only be a few weeks between 70 and 80, and we'll confirm those arrangements this week, and I'll foreshadow that. We want to make our opening as safe as possible and give businesses as much certainty as possible. And we also have to accept at the moment we have a number of cases in the Central Coast and Illawarra, and be wary of that. But one thing we're certain of is we want all of Greater Sydney to be able to have access to the regions at the same time, and therefore we need to pick the best time for that to occur. So I do want to foreshadow that could very well be at 80%, but we're only anticipating there to be 2 to 3 weeks between 70% and 80%.
Premier, will some regions...
Thank you. The roadmap that is likely to be announced this week at 80%, are they the restrictions that New South Wales will carry through to Christmas, or is there likely to be another major update following 80%?
Yeah. Importantly, New South Wales will be the first state that hits, in all likelihood, 70% and 80% double dose. But there'll also be a point in time after that where unvaccinated people will be able to participate in activities. So that is the information we'll be providing this week to make very clear when those key milestones will occur, to provide everybody with certainty. And I think the community will be very pleased, firstly, to have that certainty, firstly, to know that we are just a few weeks away from doing all those things we've missed for months. And that is a very exciting proposition. But we also have to say, and I don't want to be a party pooper by saying there's no such day as Freedom Day, but our reopening and living with COVID, finding COVID normal, will be a step-by-step process. It's not going to happen in a day. It'll take a couple of weeks or a month for us to go from starting to open up to what COVID normal looks like, and that's the responsible way to do things.
Premier.
Sorry.
Will you be providing support for businesses to police people coming in and out, the unvaccinated, the vaccinated? Are you looking into that?
Well, the New South Wales government's already invested massively in providing a great system for individuals to demonstrate that they're vaccinated when they're checking in. And we've provided that free service for businesses to download our QR system and utilise all of that. So we'll make sure that business has as much certainty as they need in relation also to density requirements. So, for example, we've already stated that at 70% double dose, it'll be back to the 4 square metre rule, and businesses can start planning that and start dusting off their COVID safety plans and know that what we'll be doing at 70% double dose isn't any different from them really pre the Delta outbreak, because they'll still obviously need to make sure that individuals are checking in, and it will also depend on the size of the venue. Obviously, if you're running a major event and you've got thousands of people turning up, you'll need to make sure you've got marshals and the like. If you're a very small business, obviously the compliance regime won't be anywhere near that onerous. So we're very particular on protecting small businesses, also really offering a helping hand in every way possible for businesses who've managed to survive what's been an incredibly difficult, not just 3 months, but really last 18 to 19 months.
Premier, the pools are expected to reopen tomorrow. Who will be allowed in, and how will you make sure that it is COVID safe? And what will be the penalties for pools that don't comply?
Well, obviously, Health has provided COVID safety guidelines for outdoor public pools, which commence from tomorrow, and hopefully the weather will warm up so people can enjoy that. And that is part of our push to make sure that people enjoy those facilities in a COVID-safe way, and obviously for vaccinated adults is key to that process. So Health's already provided the guidelines for what COVID safety plans look like. I want to thank local government authorities for working with us. A lot of the outdoor public pools are actually run by councils, but we're really keen to make sure that all of us live with COVID in a safe way. So whilst all of us would like to think that once we get to that 80% double dose, it'll be back to living without COVID, well, it won't be. It'll be a new normal. It'll be a new COVID normal, but one where we'll enjoy so many more freedoms than what we have today, and one where we all adjust our lives. And I'm confident, because of the goodwill demonstrated by everybody, that people will step up and take responsibility. There are individual penalties if you do the wrong thing. There are penalties for businesses who do the wrong thing. But in the main, the vast majority of people have just been so positive and doing the right thing. And as I've started to get a bit more out and about the last week or so, the feedback from locals on the ground has been so positive. People have been through such a horrible time, but yet we're all optimistic about the future, all grateful that those times are behind us, and grateful that our neighbours, all of us, have done the right thing in getting vaccinated.
Just back on James's question, what has prompted the rethink in relation to regional travel at 70%, and did you go too far too early?
No, a couple of things. We're obviously considering, firstly, that we want to see all of Greater Sydney open up at the same time, so we don't want to leave any areas behind. People have worked really hard, and as we see, whilst the case numbers are still high, they're nowhere near as high as what they could have been, and nowhere near as high as what they were even a week or 2 weeks ago. So the first reason is we want to see all of Greater Sydney move forward together. And secondly, we don't want to leave any doubt as to rates of vaccination in the regions. Some areas are doing as well as some parts of Western Sydney, in other areas not so much. But we're confident that as we move along, there'll be a safe way in which all of us reopen and re-engage. And given there's not a lot of time difference between 70% and 80%, that's why we're considering doing that at 80. But I don't want to foreshadow anything until we put out our plans. But as I've always said to the community, as soon as we know what the final plans look like, we'll make sure we communicate that. I know that everybody is keen to book their holidays, to book their time away. In New South Wales, it is definitely safe to book for Christmas, to think ahead for the future, but also to definitely look at November as a month where you can start planning a trip that you may not have been able to have within New South Wales for a very long time.
Will all regional areas be closed off, or will it be? Will you be able to travel to regional areas with high vaccination rates at 70% double dose?
Well, the government's principle is that all of us move forward together as much as possible. So we want to see all of Greater Sydney open up at the same time. We want to see Greater Sydney and the regions be accessible to each other at the same time. So we don't want to single out any communities. However, as the Doherty report says, between 70% and 80%, if there's a particular outbreak in a town or a suburb or a region, our health experts have every right to say to government, this area needs to restrict their mobility to within their community. We're hoping obviously that won't happen, because if you have a staged opening, you can make sure you keep things as safe as possible, because we know as soon as we open up, case numbers will increase. But the opportunity we have then is that there'll be huge vaccination coverage. That's the difference. Whilst case numbers will go up, what really will prevent people from ending up in hospital or intensive care is the fact that we have that high rate of vaccination coverage.
Given case numbers have dropped, though, below 1,000 again, are you prepared to call the peak yet?
Look, I certainly, Dr. McAnulty and I had a conversation about this just before this morning. Look, we're very pleased and encouraged by the numbers we're seeing. The modelling that we'd received and commissioned said that we'd peak somewhere in mid-September and then we'd start to see a decline in cases. That appears to be occurring now. But what we can't call is, we don't know if a super spreading event will suddenly cause a surge in numbers again. What we do know is the numbers are decreasing, especially in those areas of concern. They're going up in areas like the Central Coast and Illawarra. So whilst we're extremely encouraged by the downward trend we've seen, With Delta, you can't be complacent. That's why I'm asking everybody to hold the line. We've just got a couple more weeks before we get to that 70% double dose, because a super spreading event or a surge is very easy with Delta, and we don't want to see that happen.
You've mentioned Sydney coming out.
That was presented to us a couple of weeks ago. The hospitalisations seem to be tracking at the moment well under those modelling predictions. Is that pleasing to you to see that, but also are you factoring that into your announcement this week?
Look, we haven't factored that into the announcement, although I will say that whilst hospitalisations are lower than what we anticipate, intensive care is just marginally lower. So the intensive care numbers are slightly below what we expected, but about what we expected. So we always have to keep a keen eye on that. I think I said some months ago the two most important figures for us moving forward are the vaccination rates and the number of patients in intensive care, and that continues to be our focus. So it's encouraging to see where we are, but that still means the system will be technically overwhelmed in October, and we have to be very mindful of that. But we don't want it to be overwhelmed in November and December and January, which is why when we start opening up, it has to be in a step-by-step approach, and we'll be confirming all those arrangements this week. But I want to give everybody an assurance that the government will be standing by our commitment that at 70% double dose, every single citizen in our state will be able to do a number of things. I should say every single double vaccinated citizen in our state will be able to do many things which they weren't able to do in the last few months.
Just on those freedoms, Premier, you've mentioned a couple of times today that you want Greater Sydney to move together. Is that a commitment now that the LGAs of concern will have the same rules as the rest of Greater Sydney when we get the 70% double dose vaccination?
Well, obviously our intention is always that every citizen moves forward together, but none of us, including the health experts, can guarantee that between 70 and 80% there may not be times when particular communities are asked to restrict their mobility to a particular area, and I want to be very upfront about that. The Doherty report says very clearly, which is what the national plan's based on, that if there's a particular outbreak in a community, that health may give us advice to say people in this area should perhaps, and it could be in the eastern suburbs, it could be in the north, it could be in the west, it could be in a country town. If there is a sudden unexpected outbreak or a surge in cases, our health experts can very well give us advice to say a particular community needs to restrict their mobility, as in still conduct all those things that they want to do, whether it's get a haircut or do non-essential shopping, but perhaps restrict that activity to their local area. We hope that won't be the case, but we need to be very open that none of us can guarantee that won't happen. In fact, according to the Doherty plan, it's likely to happen. But the important thing is that all of us know exactly where we stand, exactly where businesses stand, provide that certainty and provide that opportunity for us to move together.
Premier, the Prime Minister said on Thursday that he was in discussions with you around opening the international border for New South Wales. Can you take us through how that would work as far as you understand it? Would it be open slather, you can travel anywhere, and is it just New South Wales, or would it be certain countries?
Well, certainly the conversations with the Prime Minister have been very positive. So at 80% double dose, New South Wales would like to welcome home thousands and thousands of Australians who've been stranded overseas for so long. And obviously Minister Ayres and I announced recently the home quarantine pilot that we're doing, and hopefully by then we'll have some good direction on what fully vaccinated Australians coming home can look forward to. So we're very keen to make sure we welcome home thousands of Australians at 80% double dose. And also I'm pleased to hear plans by airlines who will allow Australians to fly overseas, and the Prime Minister and I are both keen for that to occur. Other states may not be ready for that yet, but that's okay. New South Wales is moving fast, and if we feel that it's safe to do so, of course we'll allow our double vaccinated citizens to move freely. That's exactly what we want to see. I would like to see New South Wales residents who are fully vaccinated be able to go overseas at the earliest opportunity. If they're double vaccinated and they have those plans and the airlines are flying, why not?
Premier, back on public pools, an email this morning that was sent out said that staff and patrons don't need to be vaccinated to enter a public pool. What do you say to that? Is that true?
Oh, look, I've not seen the health guidelines, but
it's from a council this morning saying that they don't need to.
Well, yeah, I haven't seen what you've seen. All I know is that the health department has provided, or New South Wales Health has provided those guidelines to the people managing the public pools. I don't know if Dr. McAnulty has anything.
Well, do they have to be vaccinated or not? Premier, do they have to be vaccinated or not?
Obviously,
It's a simple question, vaccinated or not.
Obviously, the rules that we stated were at 70% double dose. Everybody has to be vaccinated.
Not before 70%.
Well,
I'm not
happening
sure. Tomorrow?
I don't know what's in the email, but what I can say is this: obviously, children wouldn't have to be vaccinated. Under 18s wouldn't have to be vaccinated. So that's clearly already been made public.
But do you need to be vaccinated to go to an outdoor public pool tomorrow?
Oh, look, that was my understanding, but if Health has revised that, I've not seen the email you're talking about.
Because you don't need to be vaccinated to go to Dawn Fraser Baths or the beach.
New South Wales Health has produced some COVID safety plan guidelines for outdoor pools, and that encourages a range of activities to keep patrons and staff safe. Of course, part of that is encouraging strongly people to be vaccinated, including staff. But there are a range of other activities that can be done to keep people safe at pools. Now, outdoor pools are outdoor, and by the nature of that, that's a much lower risk of transmission of COVID than indoors. However, people clustering together, crowding and so on presents a risk. So part of the planning needs to be about making sure there's minimisation of people coming together in crowding and encouraging as much as possible people to get vaccinated.
But will there be a difference between outdoor and indoor pools in terms of vaccinations? Would you like them to be mandatory?
So at this stage, we're just talking about outdoor pools, whereas a much lower risk than indoor pools. I'm sure there'll be further planning ahead as vaccination rates go up.
Should they be mandatory for outdoors?
Look, that's a decision for government.
Premier, further to Ruth's question about what support you're going to give businesses to ensure people don't come into their venues unless they're vaccinated, what support are you going to give businesses before the Service New South Wales QR code app is ready to include the vaccination data, because that won't be ready in time for when we reopen? And will the penalties for businesses who allow an unvaccinated person onto their premises be the $5,000 fine as it was previously for someone who didn't sign in?
Well, firstly, I wouldn't assume that we won't be ready. I mean, we don't know yet the exact date.
Dominiello said that it won't be ready. You're going to start the trial on October 4.
We don't know yet whether we'll be ready or not, because we don't know the exact date. We'll get the data from the federal government in order to incorporate that into our app. But we've been very clear about that. It doesn't cost businesses anything for people to use the Service New South Wales QR code. And obviously, if we open up before our system's integrated the federal data in terms of vaccination, we'll make sure we ask every citizen to have either downloaded or hard copy a proof of their vaccination, which they can show at request. So, look, whilst all these questions ought to be asked, I have inherent faith in the public and businesses to work together. We've done it before. Before Delta, the system worked really well. We led the nation in introducing QR codes and having people use them. It's become part of our lives. And I have inherent faith that that will continue. It won't be any different. In terms of the New South Wales government, we've obviously made sure the technology is available. As soon as we get the data, we'll be able to allow our citizens to do everything in one step to make it easier for them. But it won't be any extra stress on business. If anything, it'll be an extra thing that our citizens have to do in having the vaccination certificate as well as the QR code.
Premier, do you not think it'll create a new flashpoint for businesses, like a new front line that they have to face off with members of the public who quite simply don't want to follow the rules?
Well, it's really interesting to note that by the time we open up, at least 9 out of 10 adults would have been vaccinated. Now, that is a very encouraging sign that businesses can feel confident that when at least 9 out of 10 adults are fully vaccinated, that minimises any challenges that might be posed in relation to how people interact with business or how individuals. But even I have inherent faith, even people who've chosen or who choose not to be vaccinated do that as a choice. It doesn't mean they're going to disrespect the law, and it doesn't mean they're going to cause grief. What I have really appreciated in New South Wales is, even though we've inflicted so much stress and hardship on our citizens have responded in such a positive way, in a collective way, supporting one another. And I have faith that that level of support will continue beyond the 70% double dose. And the very high rates of vaccination give us encouragement that whilst there's always a risk of challenge, always a risk of people doing the wrong thing, it's a very small risk given how many of us have chosen to get vaccinated and move forward together.
We've got the roadmap now.
With businesses, are we going to see that clarity with the announcement coming this week about exactly whether they can face penalties and also can be shut down if they have unvaccinated people inside? Are we going to get that this week?
I mean, we'll have that available soon, but it won't be very different to what happened before Delta. So if businesses just rely on what's happened previously, it won't be very different at all. There are penalties there. There are penalties up to $11,000 for businesses or the risk of being shut down, penalties ranging to $5,000, individual penalties of $1,000 a person, but they are the exception. The vast majority of us do the right thing. The vast majority of businesses and patrons have been overwhelmingly working well together, and I expect that to continue. The penalties are there for the exceptional case because the vast majority of people, whether they're businesses or individuals, are doing the right thing and have been doing so for nearly 2 years.
Premier, how long do you think QR codes will be with us? Like, will there be a point where we can switch them off?
Look, I know Minister John Manello has said he looks forward to the day when that happens. Look, it could very well be the day, or perhaps, discussion for government, it could very well be the day that we allow unvaccinated people the full rights that vaccinated people have. And it could be that time. But we really have to consider how the next few months go. Living with COVID, finding that COVID normal will take us a couple of months in terms of exactly the right balance. But what we do know is until we have great vaccination coverage, until we know that it's safe to do so, rules like the 2 square metre rule, mask wearing in particular settings, social distancing will be with us indefinitely. The question mark about QR codes is still subject to debate. I know Minister John Manello and our government is keen not to have to use them into the future, but they'll be here, I would say, at least until around December at the very least.
Is that the same then with the QR codes and also the vaccination passport? If the Customer Services Minister is saying that they'd like to see them scrapped at 90-95% vaccination rate, does that mean it won't be until that point that the unvaccinated will be awarded the same freedoms as everyone else?
Look, I don't want to preempt what we're going to announce this week, but it won't be very long before our public has full disclosure on exactly what we expect our citizens to be able to do and when. But we are, I think, we're striking the right balance. When we publish or announce our 80% roadmap, as well as when unvaccinated people can enter society, I think the public will appreciate the safeguards we've put in place, but also the understanding that we want to move together. And that's always striking the right balance. And the key thing we need to make sure we never do is overwhelm our hospital system. And a day doesn't go by when we don't think about our staff on the front line, whether it's paramedics or nurses or doctors or even the allied health professionals, the physiotherapists. I don't think people realise that if you've had COVID in intensive care, the recovery time is months and months and months, and the support that requires. So we're always thinking about our frontline health staff and their families, and we don't want the system to be overwhelmed, and that's something we always keep an eye on, and that's what will determine the fine touches on our policies.
The government's changed its mind.
Sorry.
The government's changed its mind on regional travel at 70% double dose. You've indicated that the government's changed your mind on that in the roadmap. Is there anything else from the roadmap that we can expect to change before we reopen in as little as 2 weeks? And when will we see the public health order that will give some certainty about what is and isn't allowed and what the penalties will be or won't be?
Yeah, well, as I said, those announcements will be made this week. We're looking forward to that, and I don't want to really preempt anything else in there. The experts in government are making the final touches to those reports, but they have been subject to hours and hours of work and discussion, and I'm looking forward to making those public and looking forward to all of us making those arrangements, whether it's booking that family holiday or whether it's preparing children to go back to school. I know a lot of parents, first and foremost, just want to see the end of homeschooling, and preparing children to re-enter our schools in October is one of the biggest challenges we face, but a wonderful opportunity. So there's a lot of things for us to consider, and all those details will be made public this week.
Just in regards to the gatherings that were seen at Bondi and other beaches and whatnot on Friday, police issuing no fines there, have they been instructed in any way to go easy?
police undertake operations themselves, so it's certainly a matter for the police commissioner and the police themselves.
Do you think then that the image that's going out there, when I guess there aren't daily press conferences anymore, that we're seeing police not issuing fines for certain things, that the messaging is being relaxed, that the rules are starting to feel as though they are being relaxed?
I don't really understand the question, I'm sorry. But at the end of the day, the vast majority of our citizens are doing the right thing. Police are there to manage compliance. The reports I've received from police are positive insofar as they've seen an increase in compliance, even though people are having to put up with the restrictions for a longer period of time. So all the reports I've received are positive, and no doubt when there is activity the police are worried about, they will ask people to move on, and I'm pleased that that's occurred. I want people to stick to the rules. I've said, please don't be complacent. We have to hold the line for the next 2 or 3 weeks. It could be 2 or 3 weeks. We don't know yet when the exact 70% rate will hit. We know we'll hit 60% double dose in the next 48 hours. So 70% is only a couple of weeks away. So I just ask everybody to hold the line, keep everybody safe, because once we open up at 70%, life will feel and be so much so different. But we do have a few more weeks we have to get through.
Premier, on the NRL Grand Final, 2 Sydney teams playing. I know that there's a lot of people, my cameraman included, very keen to see if there might be something that might be allowed, i.e. vaccinated people going to another vaccinated home, pubs, anything.
Oh, look, unfortunately, I think the grand final is before we'll hit the 70% double dose figure. I'm just ecstatic that 2 Sydney teams or 2 New South Wales teams have made the final. Unfortunately, one of them wasn't mine, but that's okay. It's always next year. But just really pleased that we have 2 New South Wales teams in the final. And I know once we hit that 70% double dose, everybody will be looking forward to easier times. Thanks, everybody. Thank you.
Dr. McAnulty.
I've got one for Dr. McAnulty as well.
Please.
Yeah. Here you go, Tom.
Thank you. Just quickly, we've reports from the Poisons Hotline that they've got a lot more calls in at the moment of people administering homemade COVID treatments. Do you have a warning on that?
Oh gosh, don't always rely. Go to your doctor if you want to get treatment for anything. Don't rely on any homemade or internet advice. You know, your we have a great system of healthcare in New South Wales, and ask your doctor.
Yeah, and just in the last 2 days, we've seen 5 people die at home, diagnosed with COVID after their deaths. Can you explain how this is happening? Are people ignoring their symptoms?
Oh, I think the message is clear that COVID can affect seriously people of any age. The older you are and the more underlying other health conditions you have, the more serious the risk is, but it can affect all of us. So the first thing is get vaccinated. The second thing is get tested if you have the mildest of symptoms. And thirdly, if you are deteriorating in your health, don't wait it out. Contact your doctor or the health system or an emergency call 000. We don't want to see people needlessly suffering at home. We've got a great system for caring for people in our hospitals.
Are they waiting it out though? What's happening? Are they frightened?
It's probably a combination of things. I think regardless of the perhaps multiple things that people are thinking of when they're not reaching out for help, is please reach out for help. We'd rather have a false alarm than see you suffering. So just get tested and seek help if your condition's deteriorating.
Just a quick one on Moderna. What is the prospect of that being given to children as young as 2? I understand that is being trialled at the moment. Do you have an update on the prospect of that happening?
I don't have a specific update, but we have a very robust approval system in Australia through the TGA and other processes based on scientific data that's generated on trials around the world. So we'll have to see what comes out of those.
No timeline for how long that trial could take?
I don't know specifically. Trials are complex and often take many months, but I can't give you an update on that.
Thanks, everybody. Thank you.